this is what I think. I think that the county should not be involved in operating a venue of any kind. That's not their mandate. We own it today. If there's a way forward for that venue to provide for the benefit of Boone County residents without long-term debt, and the county becoming involved in the oversight and operation every day, then I'm all for that. I think we have a model in place with the Boone Hospital. It is a county asset. Currently, it's the single largest asset of the county, 2,000 employees, $300 million a year in revenue. I think the lease that we use for that is certainly a good template for what I would consider a viable option for that piece of property. I think we should have a private entity lease it for a long-term period in order to be able to justify the capitalization and operation and, of course, profit, and do that on a private level, not a public level. Today, Boone County has virtually no debt, and I would like to see it stay that way. I think there's a lot of competing of entities today for the county hospital's attention and cash flow. I think that BJC has been a strong partner. And in your paper, Fred Perry came out as chairman of the hospital board of trustees in favor of, he didn't want to call it a merger, but it is a merger when you look at soliciting an RFP from the university to operate Boone Hospital. It's a horrible idea. At that point, we were down to a single healthcare provider. It's being driven by other entities that I believe there's several of them that would like to see a single care provider situation in Columbia, and they're certainly making moves to that end. I think Boone Hospital should provide three things as a community asset. It should provide urgent care, it should provide primary care, and it should provide internal care. And those are the three most important factors to almost any resident of Boone County. And if that's not the case, then we probably shouldn't own a hospital. I don't think that the university is a viable option for soliciting an RFP from, no. Anytime you reduce, today there are only two choices of healthcare in Boone County. And when you merge or consolidate that, it's never good for the end recipient, which was citizens of Boone County. So no, I'm totally against Boone County or Boone Hospital being operated by the university hospital systems. I do support renewing it. Boone County has a good road system. They have a good public works system in place. The people that work there are very professional, they're engaged, they're knowledgeable. They don't, they don't squander money. I think it's really easy to want to revolt against taxes, but the benefit that we've received is enormous. We have a dedicated $1 million a year bridge plan, and it's evident in the quality of bridges that we do see. Boone County does not build roads. They built less than 4 mile of roads, 4 mile of paved roads in probably the last 10, 15 years, not very much. They're more about repairing roads and maintaining and building bridges. And speaking with the staff of Boone County, they seem to have no problem talking with their counterparts at the city. From all indications, the problems start at the elected level. I think you need people that are not going to be partisan and don't have an agenda, that are going to get in there and work for the benefit of the residents of Boone County. And if that were the agenda of these elected officials, then I think you would see a lot of this go away. Today you have a clear instance of it on Grace Lane. You have divided agenda and divided priorities. The county and the city, neither one are on the same page with regard to what's going on with, St. Charles and Lake of the Woods and Grace Lane. The traffic count on Grace Lane is going through the roof. The city doesn't want to do anything. They're going to force the county to do something. And the bottom line is it benefits neither the city, the county, nor the residents without cooperation. And it's at the elected official level. It's not, in talking with the staff of Boone County, they seem to have no problem being able to talk to their counterparts and interface and interact and coordinate with them.